Hi guys, this is my 29-week update on pregnancy and hyperemesis and so on and so forth. I'm a bit late with the video this time. I'm actually 29 weeks and 4 days pregnant today. There's a reason for that. Last week I had an absolutely horrendous week last week, and not in the way that you think. With hyperemesis, basically it all started with a midwife appointment, my 28-week midwife appointment on Monday, which was going okay until the end, and then it all sort of spiraled out of control from there. So I'll try and be brief and not go into too much detail, but just to give you an idea of what my week was like last week, and I hope never to repeat a week like it in all honesty. So I had my appointment in the afternoon. My husband took a long lunch, or was supposed to take a long lunch, came with me, and I was sat there, and basically still about 5 kilograms down from my pre-pregnancy weight, which is something that she was a little bit concerned about. She was also concerned about how pale I was, and I've had a few episodes recently of breathlessness and a couple of heart palpitations, which I have heard is normal. So I wasn't too concerned about that at that precise moment. And then she obviously had to do some bloods, and she measured my fundal height for the first time. So after she was logging all the symptoms I've got, I was still being sick at that point, but less so, and I haven't actually been sick now for almost 2 weeks. I've felt very nauseous every day, which is still a pain, but I'm grateful that I'm actually keeping a lot more food down now than I was. So the third trimester for me is proving to be slightly better on the hyperemesis front, which I'm really relieved about. So I had some bloods. She measured me, so I first realised I was measuring about 2 weeks behind on the fundal height. So that wasn't great. So she had to refer me on for a growth scan at this point, because it's the first measurement and it's underneath the 10th centile. So she said, because of that, I have to send you on. She said it could be absolutely nothing whatsoever. As long as you follow your own curve and baby shows it's growing, then all should be fine. It's just because the first plot on this graph is under, I have to send you for this growth scan. So I was like, okay, excuse me, that's fine. So she did some, a little bit of history on me with blood tests. I've had quite a lot of bad experiences with blood tests. My veins are very spidery and they hibernate, basically, which makes it very difficult for nurses to get blood from me. And because of that, the procedure has always been very long, very drawn out, and not that pleasant for me, which means 9 times out of 10, I do go a little bit peculiar. I'm better off lying down and just coming to on my own, rather than sitting in a chair and it all going horribly wrong from there. So I've never actually full-on fainted from a blood test. I've always just gone a little bit weird. Especially if they're struggling to get blood out. So that's just a little bit of a brief history of me. I'm not the best with needles. So we had a joke, because this poor lady, this poor midwife, was the same midwife who did my bloods at the beginning, and it took her 35 minutes to get 3 vials of blood. She couldn't get 3 vials of blood, she could only get 2.5. She said it was like splurting out, and hardly, it was like dripping out of my veins, basically, so it was really hard work. So I made a joke saying, oh god, well, you've got me again today, poor you. She said, well, I know this time that there's like one vein that I can get blood from you, so we'll just take it easy. So I went to the bed, was lying down. She went from the vein that I recommend she goes from, because that's the one that we tend to have the best luck with. She got blood out straight away, 2 vials, done, dusted within seconds. I was absolutely made up. It's the best blood test I've ever had. So we made jokes about it. It's like, woohoo, that's the best blood test ever. She said, oh god, that was so much better than last time. And you know, Tim, my husband, was there, and he's like, oh, that's the quickest blood test you've ever had. So we're all really pleased. And then within about 5 minutes, I'd started going very, very peculiar. Now, I was not expecting that, because like I said, everything had gone really, really well. I hadn't worked myself up, because, it was really relaxed atmosphere. My husband was there. It was all fine. And for whatever reason, I started going really weird, like really weird. I don't know whether it was a combination of things, the fact that I haven't been well, and just the whole situation. I don't know. But to cut a long story short, I actually full on fainted. So it wasn't great. The doctor had to come in to check me over. It wasn't brilliant, unfortunately. So my husband decided that we were going to go home and he was going to take the afternoon off work just to make sure I didn't have any other funny episodes, and that there was somebody at home with me. But because of everything, because of my fundal height being smaller, and because of the fact that I wasn't well, I'd fainted, I was very pale, so on and so forth, she also wanted me to have a consultation done straight after a growth scan. So she booked it for first thing the following morning, which was the Tuesday. So I had a growth scan done at 8:30 at the local clinic, and then I had a consultation straight after in regards to hyperemesis and also the growth scan and how that had gone and where I was actually plotting baby-wise. So growth scan went fine. It was like 5 minutes of a job. She just measured everything she needed to do and then passed it on to the consultant. So the consultant sat me down and said, baby's measuring fine. Everything seems fine to me. It was just above the 10th centile line based on the actual measurements of the baby rather than just my bump. So that was great. That was reassuring. But I was a little bit stressed in the situation because you do worry, don't you? First baby and all, and you don't want things to be wrong. So you do get yourself a little bit worked up in situations like that. I like to think you do, or you're allowed to at least. So yeah, she then sat me down and she said there's glucose in my urine, which I have mentioned on previous videos that I'm now monitoring that by a finger prick test rather than doing the glucose tolerance test because there's just no way I'd keep that fluid down. But she was really insistent and I was getting quite shirty with this consultant by the end of it, which again wasn't great for my stress levels, saying I'm going to a diabetes specialist nurse and we're monitoring it differently simply because I've got hyperemesis, I'm dealing with enough. I really don't want to make myself stress out even more. I've just got into a fairly good place with trying to get food in. I can't starve myself. It makes me feel 10 times worse. And if you are a hyperemesis sufferer, you understand that an empty stomach is so much worse than a little bit of food. So I very rarely have nothing in my stomach. I'm always snacking on little bits of things if I can. So the idea of that test is just a no-no for me, and the diabetes nurse has said if they ever keep insisting just to tell them you're monitoring it, that she's happy with everything, my blood sugars are coming back perfectly normal and there's no reason to do a GTT test. So I explained all of this numerous times to this consultant who was insistent that she thought I'd still need this test, and I basically just categorically said no. I don't like being a difficult patient, but I'd been told by the diabetes nurse that everything was fine. This was instead of. So anyway, she dropped it in the end and she said, right, okay. She said, well, I'm going to book you in for another growth scan then. I was like, that's fine. I said, let's monitor this in a slightly different way if we can, because I'm being pushed to my absolute limits here with hyperemesis and pregnancy in general. I feel absolutely terrible all the time. And really and truthfully, I'm trying to make my life as easy as possible rather than putting myself under anything unnecessary. So eventually she backed off with that. But she said that she wants me to see another growth scan, which is fine, which was in 4 weeks. And she may want me to see a diabetes specialist towards the end to monitor things. I said, that's fine. Do what you need to do, but I'm not doing the glucose tolerance test. I'm finger pricking myself every damn week and monitoring it that way. So it's not that I'm ignoring it. I'm doing what I've been told to do. But anyway. So she said, right, okay. Well, she says, not to worry. All I need to do now is your saturation levels, which is your oxygen, and I just need to do a heart rate. So I was like, great, no problem. But I've been obviously sat in this room, sort of semi-arguing with a consultant, a bit stressed out about the growth scan, making sure everything was fine. So naturally, it's not exactly the most relaxing environment to be in. So saturation levels were fine, but my heart rate was about 110. little bit of a backtrack on my heart rate. I have a fast heart rate anyway. My resting heart rate has always ranged between about 80 and 90 something ever since I was quite young. I have had it checked before. I got diagnosed with an ectopic heartbeat, so I have had this check before. So anyway, it was 110, and to me that's nothing because I'm pregnant, so your heart rate does increase anyway. And I was sat in an environment that wasn't very pleasant. I'd just been arguing and got a little bit stressed out with the consultant. So I was expecting it to be raised anyway, but she was not happy at all that my resting heart rate was 110. So she said, I want you to go to triage and I want you to get an ECG done today. My husband had taken the morning off, a holiday, annual leave. And I just said to her, what now? I said, why? She said, well, your heart rate's really fast. I said, well, I do have a fast heart rate anyway. So to me, it was only about 10 or 15 beats more than normal for me. Anyway, she was insistent and I'd argued with her enough. So I said, right, okay, so should I ring through to triage now and find out, where you can go and stuff? And she said, oh, actually, triage don't do ECGs. You're going to have to go to A&E. So, to cut another long story short, I ended up in A&E. My husband said, well, we'll just see how it goes. I may have to try and take the afternoon off as well. He didn't want me sat around by myself, which I was very grateful for. So got to A&E, they padded me all up with the sensors for this ECG. I had the ECG done, everything seemed fine. Then I got passed to a different waiting area. And the nurse basically just said, oh, just come with me. And I just assumed they were going to have a bit of a chat with me about whatever it was. And then I'd be on my merry way. However, she said, oh, I just need to take some bloods. Now, because of the way I'd been the day before, after this blood test, I definitely got myself worked up. Really and truly got myself worked up about this blood test because I'd had a good blood test and fainted for the first time ever. And this time I started to panic well before the blood test, which I hadn't done the day before. So this is why it was unexpected. So my husband was sat in the waiting area because I just assumed I'd just be going in for a little bit of a brief chat. However, I wasn't. I was having bloods done. So I just said to her, please don't hook me up to that ECG and heart monitor now, because she wanted to. I said, because you're going to get a really false reading of my heart rate because I hate blood tests. I struggle to get bloods done. They usually don't succeed with me very, very easily. And also, if you're basing all of this on a heart rate, it's not going to be accurate. Anyway, she said, oh no, I have to do it. So she put the sensors on and I said, listen, I fainted yesterday, so please can I lie down? Trying to be sensible about it, trying to calm myself down best I could. But my heart rate was just getting faster and faster and faster and faster, and I could feel it, physically feel it racing. So I said to the nurse, please go through that vein, like I'd said to the midwife, because it's the one that you get the most luck with. So she ignored me. She went through a different vein and got nothing. Absolutely zilch. She said, I'm not even going to drop. So at this point, getting a little bit more worked up. Really don't like the sensation of being poked about with a needle. I don't think anybody does, but I don't react to it very well at all. Call me a wimp, I'm okay with that. So I started going very peculiar at this point, and she went in and out with this needle, trying to get in this same vein, which I told her not to bother with. And nothing. And at this point, I fainted. My heart rate apparently hit nearly 190, and I had what was called a narrow complex tachycardia on my ECG, which is a very strange heart rhythm. And as I came to, another nurse came over and said, can I have a go doing your bloods? So of course my heart rate wasn't really coming down a lot because they'd had no success whatsoever. So she sat there and I said, yeah. I don't think they saw me faint actually that first time because the nurse had gone away to get help, obviously, to come back. And then I ended up fainting again. This nurse was trying out of the wrong vein, and I said, just stop. Try out of that one, please. She said, okay. And she got 2 vials eventually. It took them 45 minutes to get 2 vials of blood from me. And in the meantime, I'd had a massively high heart rate, my ECG went crackers, and I'd fainted twice on this bed. So my husband knew there was something wrong because I'd been so long in this room. I came out basically after I'd come to with a glass of water, and because of everything that had happened, they weren't happy, so they wanted me to sit in observation in A&E, hooked up to like a heart monitor. So that was where I ended up for about 4 hours. My heart rate didn't come down past 110, but I was in A&E, surrounded by nurses and doctors. And then all of a sudden, the nurse pipes up about 3-4 hours down the line. "Have you got a cannula in?" And I was like, "No." And my heart rate is being monitored, obviously. And my heart rate hit 160 within about 30 seconds of her mentioning the word cannula. Because of everything that had happened, every time someone mentioned needles, I was just going into complete panic mode. Because of how I'd been in the past 24 hours, basically. So I'm fine with cannulas normally. I actually have better luck with things going through my hand than I do through, where my elbows are. But anyway, this lovely nurse came over and she said, "Just calm down, don't worry." And I said, "Please go through my hand." And she said, "Oh, no, I do cannulas from here." I said, please put the cannula in my hand." Nobody likes to listen to me. They all think, "Oh, I know my job." And I'm sure they do know the job, but I know my own body. So she said, "Well, I'll have a look for a vein there." I said, "You won't find a vein in that arm." And she said, "But if I don't see one, I will put it in your hand." So she looked, couldn't find one, put it in my hand. In straight away, no problems whatsoever, hooked up. My heart rate started coming back down. I was fine. I was lying down on a bed. It was not a problem. It was fine. But my heart rate had obviously gone up. Of course, everything was being monitored. So because of all of this, they wanted me to have a CT scan because they thought that I could have a pulmonary embolism. Because my heart rate was going so fast. So they wanted me to have a CT scan, but unfortunately that was going to be the following day and that I'd have to be admitted to the medical assessment unit. So my husband basically went home, got his tea sorted, brought me back an overnight bag. I got admitted to this ward. This was Tuesday evening, and I was going down for a CT scan the following day at some stage and hoping that these results came back clear. I got no sleep whatsoever on this ward because there was a lot of elderly ladies, bless them, dementia, all sorts of other problems, people soiling themselves in the night, shouting out, coughing. I'm not joking yet. I'm not over exaggerating. I think I got about 30 minutes sleep, if that, and it wasn't really sleep. So I was, the following day, the Wednesday, I wasn't myself at all. I was very, very emotional, very, very tired. I was crying at everything, just silently to myself in this bed on this ward, feeling as miserable as sin. Heart rate was racing every time nurses approached me. I had to have fragment injections because they were worried about me having this embolism. So they were just doing like a safety thing, but they asked me for my pre-pregnancy weight. And without really thinking about it, I gave them my pre-pregnancy weight, but I'm down 5 kilos. So it ended up being, they gave me way too much fragment. My gums started bleeding. And then when they realised, and I said, "Well, actually, I'm down 5 kilos," they said, "Oh, that's why you've had like more than double the dose. So you won't be needing any more of that." It wasn't harmful to me or baby, which was my main concern, but obviously it wasn't very pleasant for me. So I had the fragment injections done. Then the following day I had to go down for the CT scan. Never had a scan before. And because of the whole situation, lack of sleep, very emotional, wasn't exactly feeling great anyway. And the sensation of the dye as it was going through my cannula is horrible. You make you go really hot, feel like you're going to wee, and then you get this awful metallic taste in your mouth. It's just not a very pleasant sensation at all, and that sent me a bit odd, because like when you go really hot and really flush, it feels like you're going to go faint anyway. And I was lying on this bed completely flat on my back, which isn't comfortable for me at the moment, being 29 weeks pregnant, with this big lead cover over me, which was heavy. So I was really uncomfortable. So they ended up wheeling me back up on a trolley rather than on a chair, just in case I did have a funny turn, because they didn't want me to fall. And I was really hot because of this dye as well. So I ended up having like a bit of a fan on me, and they put like a cold compress on my head. The nurses were great. I just felt like the biggest wimp ever, and it wasn't it wasn't because I was getting myself worked up about it necessarily. The sensation just wasn't very nice. And I just reacted to it quite badly after everything I've been through the past couple of days. And it was just a waiting game. Like, what is these results? Have I got a pulmonary embolism or not? So I was, worked up because I didn't know what was going on. Oh, so the consultant comes round and I'm asking the nurses, have my results come back? And bearing in mind, the MAU ward, it's not really a proper ward, and the visiting hours are from 8 a.m. till 9 p.m. It never stops, that place. It's absolutely packed all day, every day. You can't get a minute's rest because you're just aware of people all the time. It's just always loud. So I was getting really fed up. I hadn't really got any provisions with me. I hadn't brought my headphones because it was just a quick overnight stay. So I was just going beside myself in this ward. My husband works all day, so I had no visitors, whereas everybody else had loads of visitors all day. I had nobody. I was on my own, waiting for Tim basically to finish work. So they said, oh, you should be discharged today because when your scan comes back, it's all clear, it'll be fine. We're not suspecting that you do, but we need to take the risk out completely by doing this scan. So I was sort of getting excited to go home. And then it turned out I wasn't going home. They wanted me to have an ultrasound done on my heart as well. And that would have to be the following day. So, of course, I got really, really, really upset. Again, crying my eyes out. Tim didn't want to leave me, my husband. He was really upset that he was going to have to go home. He refused to leave at 9 o'clock, which is the visiting hours. He said, please, can I just stay a bit longer? She's just not in a good place. So this lovely nurse who took pity on me because she'd worked the night shift and saw what this blooming woman was like all night, screaming out, being really abusive. She said, yeah, okay, just be as quiet as you can because it's technically night time. As well as all of that, they realised I was taking ondansetron, so they took that off me, put it in a locker, wouldn't let me take it when I needed to take it. So that got me really worked up because then I started feeling terribly sick because I usually take it about 5:30. I've taken 3, my last one at 5:30, and they didn't let me have it till 9:30, 10 o'clock at night. So I was starting to feel really poorly by this point, which actually made me realise just how much those tablets are doing for me on a regular basis. So I was getting upset with that. Tim had brought me some headphones. So before he left, he made sure that I was comfortable in bed, that my headphones were in just on one side, that I got like nice plinky plonky music that I could try and fall asleep to, or like my Harry Potter audiobook or whatever. And he basically gave me a kiss and off he went. So I was in a pretty low place, pretty miserable place. And the following morning, I'd managed to get about 3 hours sleep, which was slightly better than the night before. The doctors did their rounds, said to me, we're going to send you for an ultrasound this morning early on. So I was like, great. And then all being well, we just want to refer you on to a cardiologist as an outpatient, to a cardiologist rather as an outpatient, to get this heart rate monitored because everything else is coming back clear, which was great. So I got whisked down to have this ultrasound done. That was all fine. She said very normal, very boring. I said, that's fine by me. Went back up to the bed and basically I was just waiting for discharge. So my mum came all the way from Sedbergh to pick me up because my husband was obviously working. And I came home about probably 1 o'clock, 1:30 on the Thursday. So I'd been in hospital since very early Tuesday. And it ended up being an epic sort of 2.5, 3 days of hospitals, A&E, various things. And I'm still none the wiser as to why my heart rate is so fast. But as soon as I got home, I felt much more relaxed. I had a bath, I sorted myself out. My husband was so pleased that I was at home. I was so pleased to be in my own bed. I can't tell you. I felt like I needed to sleep for a week. So that was my week. I know it's been 25 minutes of me talking about this ordeal, and I'm sorry if I've bored you, but, I felt like I was just getting a handle on being pregnant in a way, and sort of coping with it in my own way. and then it all sort of went wrong last week. I'm just grateful that baby's fine. I'm falling to bits, but baby is doing fine. Yeah, so it's been really, really hard. Last week was really tough, so I've only really felt like talking about it today. Yeah, I'm going for a scan on Friday, which was booked months ago, because I thought when I get to 30 weeks, it's a big milestone for me, that, because the following week you start seeing it single figures left, which is a huge deal for me. Seeing 9 weeks to go is going to be amazing. So we decided to book a 3D scan as like a celebration, really, of getting to 30 weeks. And we're going at 6:45 on Friday at a local private place in the sort of local town to me. My husband's obviously coming to that because it's an after work thing. So I'm really looking forward to seeing Squishy, we've been calling him, on a 3D scan. I've never had a 3D scan before. This is the first time. I've not even really seen anybody else's properly. So I'm really looking forward to that. Hopefully he'll be cooperative and I won't need to go back for another one if he's not in the right position. But we'll just see. So that's happening on Friday. So I should hopefully be able to show some pictures maybe next video. In regards to hyperemesis, like I said, I'm having a slightly better time of it. I'm feeling very, very sickly most days, but just trying my damn best to ignore it best I can, eat little and often, and just keep picking really at things, trying to have slightly bigger portions for things like my tea, to put a little bit of weight on, because that is a concern for the midwives at the moment. I'm just trying my best to basically stay out of hospital, because I was hooked up to IVs and all sorts of things, because I was dehydrated. I'm not drinking enough, I know that. I'm just trying my best. So third trimester for me is proving to be better on the hyperemesis front than previous 2 trimesters, but there are a few other complications now which I'm hoping aren't going to affect my due date. I'm hoping I don't have to be induced early because of this heart rate thing, but until I've seen the cardiologist I won't know for sure. We'll just have to take that as it comes. But anyway, thank you for listening to me rant. Like I said, it's a week I don't want to repeat ever. Hospitals are a horrible place, but the nurses work so hard. They do an incredible job. I've got no complaints whatsoever with the care I received. It was just the whole situation was pretty terrible from start to finish, and I was very glad to get home. So yeah, I'm coming up to 30 weeks on Friday. I'm very excited to get to that milestone, and hopefully I'm going to have an easier week and I won't be quite as depressing next time I'm on the videos. But yeah, I'll see you next week. Bye.